Hello everyone and welcome to the second In Focus session of this day of Wish conferencing. For those of you who have just joined us, these In Focus sessions are special sessions delivered in collaboration with our partners on important healthcare issues being faced across the world today. Now, our first one earlier today focused on the idea of localization and empowerment of local communities to drive change and reform healthcare systems. And if you're interested to watch back that session, see a link to the recorded session. It is now available on the Wish website. But let us turn our focus to this session. I'm proud to say it is being presented in collaboration with the Carter Center in the United States, and it's titled Pathways to Disease Eradication, Lessons Learned. And today we hope to shed light on and celebrate, really celebrate, the 40th anniversary of the eradication of smallpox, alongside the global health experts who led that very campaign, which of course resulted in the eradication of smallpox. And of course, experts now working to replicate this success against guinea worm and other devastating afflictions. So this is a crucially important debate. The lessons to be learned are so very important, and I'm delighted to say that to tease out some of the lessons and look forward as well, we have three wonderful guests. So in short order, let me invite you to meet them. And gentlemen, we can see you on our screens. I wish we could all be together in the flesh, but of course this year things are different, so we've got you on screens. So when I introduce you, if you could just give a wave so everybody across the world watching this knows exactly who is who. So Donald, let me start with you. Dr. Donald Hopkins. Now, he brings vast experience to this discussion. He directed the smallpox eradication program in Sierra Leone, get this, back in the late 1960s. He was acting director of the Center for Disease Control in the mid-80s, and he has long been at the center of the Carter Center's efforts to eradicate guinea worm disease and river blindness. So, Donald, a very warm welcome to you. On the top screen alongside Donald is Adam Weiss. Now, Adam has had very long experience in the field, mostly in Ghana and Ethiopia, but across different countries, combating guinea worm. And he is now the director of the Guinea Worm Eradication Program at the Carter Center. And then on the bottom screen, we have another giant of this worldwide effort to eradicate disease. He is Dr. William Fagey. Now, he is Senior Fellow Health Policy at the Carter Center. He is an epidemiologist. He's got a long record of achievement. He was chief of the Smallpox Eradication Program at the Centers for Disease Control. He was director of the CDC. He became executive director of the Carter Center. And the list goes on. I'm trying to read the rest of this. He served as medical advisor to Bill and Melinda Gates for several years. He is also professor of international health at the Rollins School of Public Health at Emory University. So we have got fabulous experience on this panel. We want to learn the lessons of what happened in the triumphant battle to eradicate smallpox, and we want to look forward. We're obviously going to have to reflect on the realities of COVID-19 a little bit, but also on the other diseases which have the potential to be eradicated. Let us start, though, for those who are not absolutely familiar with the different terms here when it comes to combating disease. Don, I want you to start by telling me what exactly eradication involves and how big a challenge it is to get all the way to eradication of a disease.
Eradication means ending a disease worldwide, so that the disease no longer exists anywhere on the planet, and the control measures, therefore, don't need to be applied at all any longer. When you get down to the last few cases, however, it gets to be increasingly difficult, as I like to say, because the last cases are always self-selected, almost by definition, in the most difficult areas to work. And so it gets increasingly difficult as you approach zero, and proportionately also more expensive.
So the hardest yards of all are those final yards. When you, as you just said, when you're down to the final few cases, what has to be different in the nature of the campaign, the eradication campaign, when you reach that final stage? How does it have to be adapted to move from almost eradication to complete eradication?
It requires intense focus, because when you think of it, as you get down closer and closer to zero, the stakes grow proportionately much greater, so that when you have several hundred or even thousands of cases, missing one case is less important than when you get down to, say, 5 or 6 cases. In that instance, when you miss one case, you make your problem much greater. And in the case of guinea worm disease, missing one case means that you won't know whether that case has propagated until a year in the future. Moreover, you won't know where it might have affected other people as well. So as an additional problem at the very end is that often political leaders become anxious to turn their attention and funding elsewhere as cases get fewer. And so the almost paradoxically, the importance of maintaining political support for the program also becomes increasingly difficult often as you approach zero.
That is a very interesting point. And at the beginning of this session, and I should say, by the way, I maybe should have said it earlier, that this session is all about interactivity, as all of our sessions at WISH try to be. So as we listen to the great expertise on our panel today, I do want you, all of you watching, to be thinking of questions, observations you might have if you work in this field, or you have any connection to this field, or if you're just like me, an interested layman. Do put forward a question on the WISH platform, and after 30 minutes or so of conversation, I'm going to make sure that I get your questions put to these three gentlemen. So please do use the WISH platform for that. But now I want to turn from you, Don, to William, or Bill. I think most people call you Bill, so I'm going to take the risk and do that too, Bill. Again, on this question of learning the lessons of smallpox, what was, it is, as I understand it, the only disease in the world that has ever been truly eradicated. So what made the effort to wipe out smallpox throughout the world successful, and why has it not been replicated in the fight against other diseases?
It is the first human disease to have been eradicated. There's one animal disease, rinderpest, in cattle that has also been eradicated. I became interested in smallpox eradication 55 years ago. And as you mentioned, we've now gone over 40 years without a case of smallpox any place in the world. And people wonder, why was smallpox selected for eradication? Well, there were a number of reasons. It was a very ugly disease. Voltaire got smallpox and began studying it. He came to the conclusion that 60% of children in Europe at that time would have smallpox sometime during their life. And he said of the 60%, 20% would die, 20% would be scarred for life, and only 20% would get through this scot-free. So it was a bad disease. And it continued, even though Edward Jenner in 1796 showed you could prevent it by giving cowpox to people. It continued, so that in the 20th century, there were still 300 million deaths in the world. But yet a third reason, I think, for selecting this disease is we borrow so much from our grandchildren. We leave them with debts that they will have to pay off. Disease eradication is one situation where we actually do something for our grandchildren, so that they never have to be bothered by this problem again. So what are some of the big lessons? Well, number one is to trust the science. Science is not always certain, but it's as close as we get to certainty. And so science is not always correct. It's not the gold standard in the sense of always being right, but it is a pathway to finding truth. So number two is know the truth. You can't actually get rid of a disease unless you know what is causing it, who's getting it, what you could do to interrupt that. Knowing the truth turns out to be absolutely essential. And that's why we have surveillance systems to get denominators and numerators, know who's having the problem. The third thing is you need to form coalitions. It requires lots of people and lots of groups. With smallpox, you start with WHO and over 190 ministries of health. You look at all of the countries that were involved in producing products, vaccines, contributing people. You look at the countries with smallpox, and their health departments were involved, their schools were involved, and hundreds of thousands of people involved on the ground, actually finding cases, finding contacts, vaccinating, doing a million different tasks. So it required a coalition. The last lesson I'll mention, there are many of them, the last one I'll mention is we found out again that the best decisions, the best policies are based on best science, but the best results are based on the best management. And so the question is how to bring the science and management together. It's often been said that an ounce of prevention is worth a pound of cure, and that's true. But as someone has said, it's a ton of work. And it was a ton of work, but everyone is so pleased that we actually did the job and now have gone over 40 years without a single case any place in the world.
Well, I think that idea that we as a species are so pleased is, if anything, an understatement, because if we think about the impact COVID is having on the human population around the world today, imagine how much worse it would be if smallpox was still rife, a disease that is so much more damaging to people than COVID, albeit COVID has caused tragically so many deaths, but smallpox so many degrees worse. What you two have said about the disease and about your recollections. Sorry, were you going to say something, Bill? Go on.
I was just going to say that with smallpox, it's so important that we seize the moment, because once HIV came on the scene, we would have had a great deal of difficulty doing smallpox eradication because of the immune system and the complications with HIV and vaccine. So you have to seize the moment.
Right. Right. Well, that thought then I'm going to put to Adam, because Adam, you're sitting alongside, albeit on a screen, you're sitting alongside two of the greats of the fight against smallpox. You, of course, are dedicated to the fight against guinea worm. And, you know, I think people have told me there are basically about 8 diseases around the world which have the potential, should we invest right and do the right things over the next several years, have the potential to be eradicated. And clearly, guinea worm is one of them. So you tell me, as you listen to these two with their great experience, does it give you confidence that you have the tools, that the international community is giving you and others the resources to complete another a successful eradication program?
Without a shadow of doubt, eradication of guinea worm is within hand, and it's in great dedication of Doctors Fagey and Hopkins for laying the pathway for that to even be possible. Not only did they lay the framework for eradicating guinea worm for the entire world to pursue, but also in building coalitions like the International Task Force for Disease Eradication that actually deliberates the science, the management, and all of the component parts that are required to pursue something as kind of paramount as eradication is. And the guinea worm eradication program, like polio, has faced setbacks. And oftentimes we talk about how difficult the last mile is, and in our case, globally, thinking about the last kilometer, it's not an easy fight when you get to the tail end of it. But what it requires is a continued investment in innovating, not only from the top down and thinking about what technology can provide, but also in innovating from the bottom up. And I think you had a session earlier on the importance of community engagement and community involvement. And what Drs. Fagey and Hopkins really built into the design of the guinea worm eradication program was to maintain a constant feedback loop with communities. And so it's not being driven only top down. Of course, you need the political will that Dr. Hopkins mentioned earlier, but you also need the buy-in from communities, from local leadership. And that's really where the last kilometer or the last mile is going to be won, by making sure that they're engaged and involved every step of the way.
Well, that's a great point, and I'm mindful that as we live in this era of COVID, and when public trust in the science is such a real issue in all parts of the world, developed world, developing world, there are many skeptics out there when they are confronted with the science, whether it be the nature of the disease or the discussion of a vaccine or whatever. There is a lot of skepticism out there. So, Don Hopkins, let me come back to you. You did a lot of work in Sierra Leone on smallpox. So just give us some more sense of how, as Adam says, you have to engage with local communities. What are the key elements to successful engagement? How did you make it work, and how, going forward, whether it be with guinea worm or efforts to eradicate other diseases, what do we need to put as our priorities in terms of this bottom-up engagement?
An important element of the smallpox program was that the disease itself was horrible. It was horrible to look at. It was frightening. And in Sierra Leone, when I went there, Sierra Leone was reporting more cases of smallpox per capita to the World Health Organization than any other country on Earth. And so people in the country knew what this disease was, they feared it, and therefore they were very receptive to the idea of making themselves available to be immunized. And in that instance, we didn't have to persuade people to accept this help. However, we did have to still approach people with respect, which was very important. Explain to them that we understand this disease is terrible, that there is this vaccine that's available to help protect them and their families from it, that there were no side effects specifically to worry about with this vaccine, and help them understand that we, the people from the health department, were there to help them take care of their problem in their community. We then, in working with the leaders of the community, got the communities to agree, when we were using mass vaccination, to agree on the time and place when the communities would get together, assemble themselves for the mass vaccination program, the mass vaccination teams to come and immunize them. And then as individual communities experience this mass vaccination, experience being vaccinated, seeing that there were not terrible effects from the vaccine, and realizing that they were now immune, other communities becoming aware of that were more and more receptive to the idea of receiving this vaccine as soon as possible. In the case of guinea worm disease, in contrast, you have a problem which people also fear, which is also very, very visible, but it is much more difficult to get people to understand that they are getting this disease by actions taken a year before in drinking contaminated water. And so the challenge there, again, approach the community with respect, explain to them what's happening in a way that they can understand it, and then, having gained their trust, teach them the interventions that are available, let them see and hear testimony from other communities so that they then begin to trust people from the health department and implement the measures. But unlike a simple vaccine, in the case of intervening against guinea worm disease, we're encouraging communities to do things which must be sustained over a period of time. And so that is another element of difficulty in the case of guinea worm prevention that did not apply for smallpox.
Right. Adam, let me ask you a pretty blunt question of economics. I mean, you're still totally engaged in the eradication effort for guinea worm, working in I think, a very small number of countries now in Africa. Now, you still need the support of the international community in terms of serious financial backing. I guess you still need, you and others involved in the effort, you need tens of millions, maybe hundreds of millions of dollars, I don't know. But right now, we're in a world where, frankly, public attention right across the world is much more focused on what is perceived to be the mass threat of ill health due to COVID-19. How can you persuade political leaders, leaders of the biggest international, NGOs committed to global health, how can you persuade them to continue giving you significant financial backing when, frankly, there are only a few hundred cases left of guinea worm in the whole world at a time when they might think, you know what, the dollars that I could give to Adam would be much better spent adding to the international effort on COVID or on a host of other diseases, maybe malaria. Why does your effort still justify significant expense?
Well, I think some of the greats in public health that are with us here today, Drs. Fagey and Hopkins, have said many times, it's not an investment in one thing or the other. That in fact, the investments that are made into the guinea worm eradication program have not only immediate term impact on other diseases, but also long-term impacts on the human resources that are available to fight things like COVID-19. The basic tools of epidemiology that are instilled upon community-based volunteers, instilled in staff of the ministries of health of the respective countries, those are resources that can be tapped into not only for guinea worm, but for COVID-19, for polio, and other diseases that really devastate communities around the world. And so I would say to the world, an investment in guinea worm to see eradication through not only instills hope and inspiration to coming public health leaders and supporting healthy, viable populations that can pursue their own individual aspirations, but also in terms of providing key investments into building sustainable, long-term public health structures that we now know, based on COVID-19, we need more than ever. The contact tracing that is required for COVID-19, that's what guinea worm workers in remaining endemic countries do every single day following up on guinea worm cases. And so that's really where this becomes a key investment for the world to continue to pursue.
Right, so there's a whole pot of collective and important knowledge there. We've skirted around this sort of the tying of this debate we're having about eradication and the lessons learned from smallpox. We've skirted around the issue of COVID-19, but I'm just going to ask you, and maybe Bill, you could take this on with your experience. When you look at the way the world has responded to COVID-19, and of course now the focus and the excitement is all about the possibility of a vaccine that might be rolled out at the end of this year and through the course of next year, which Pfizer and BioNTech are telling us should, they think, be very effective against COVID-19. Is the word eradication relevant to our efforts against COVID-19, or is it much more a question of just tight control thanks to the vaccine, but we are not looking at eradication? Or is eradication something that should be on the agenda for COVID-19?
The word eradication for COVID-19 is premature. And let me go back just for a moment to the economics. When the US became involved in smallpox eradication, we had not had a case of smallpox for over 15 years. And so it took some doing to convince our government that this was worth the investment. But we now save that investment every 3 months because of eradication. And we save more money in the US because of smallpox eradication than our dues to WHO. So there's the economic argument. The second thing on culture, I learned a long time ago, if you tangle with culture, culture always wins. And we have to remember that with COVID-19. With these new vaccines that are about to appear in the marketplace, this is a great step forward, but it doesn't substitute for what we've learned about masks and hand washing and distance, because 50% of people in the United States say they would not take the vaccine. And so here we have a cultural problem, because even if it's 90% effective and 50% of the people take it, that still leaves 10% of those having taken it who are not protected, but you don't know which 10%. So they have to continue using masks. And it also means 55% of the total population is unprotected. Nonetheless, the vaccines will be a very good step forward in controlling this disease, and culture will appear, because the people most reluctant to take the vaccine in the United States are people in the minority population who would benefit most. And so we have to find, who do they trust in order to get the message across that the vaccine is actually useful. My hope is that with the first vaccine doses given, we will see the results of a reduced incidence in those people, and that even the reluctant people will then be willing to take the vaccine. But all of these problems are very complicated, and to even think about eradication right now is very premature.
That's very helpful. That's a great, simple way of explaining to us we shouldn't run before we can walk, if I can put it that way. Thank you very much, Bill. Everybody watching around the world, I did say at the beginning that we wanted your questions and insights and observations to put to our panel here, and now's the time. I'm just going to flip from me driving the conversation with my own questions to what I'm sure will be much better questions coming from you guys. So let's formally declare now that the focus here on this panel is going to switch to your questions coming from around the world. Okay, so that little pause gave me time to just look at the questions that are coming in, and there are plenty coming in already. So why don't I just, because Don, you haven't spoken for just a little while, I'm going to put this one to you, and it builds on what Bill was just saying about trying to persuade people to trust what science is saying about the vaccine, and for people essentially to take the science at face value, take it seriously. This question basically says, clearly behavior change is hard, and right now we have some political leaders who in many ways are spreading anti-science messages. How worried are you about this, and how do you overcome disinformation and political apathy when it comes to really getting momentum behind a public health program, including an eradication program?
Well, I should say up front that I'm by nature an optimist, but I think that the most important thing, again, is to recognize that each individual will act in what they perceive to be their own interest. And so the challenge for us in public health is to, A, convince them to trust us, convince them that we are there to help them, and then to explain in a way that they understand and accept whatever intervention it is that we are recommending to them. As I like to say, most people are rational. and if approached respectfully and given the information in a way that they understand it, they will act. I mentioned earlier the difficulty in getting people to understand the fact that they were getting guinea worm disease from actions they did a year ago. Going into communities, going down to the pond where people are drinking contaminated water, filtering that water, backwashing it, and holding up a jar of the water so that people could see little things swimming around in the water helps them to understand, make the connection between guinea worm in the drinking water in a form that you usually cannot see and their infection. And in that instance, then people begin to understand. Additional testimony then from other communities and individuals who have gone through this experience, having seen guinea worm prevalent in their community, and then taken the actions that were recommended, and then seeing the guinea worm disappear, that becomes very powerful testimony as well, and convincing testimony in a way that people are then moved to act and protect themselves.
Thank you very much, Don. Adam, I think this one's for you. The questioner just wants to know, how has COVID-19 and all that has been brought with it affected your eradication efforts, and I guess other programs like polio eradication? Has there been a knock-on effect from this sort of preoccupation we see around the world right now with COVID-19?
That's a great question. There have been some impacts for obvious reasons related to COVID-19 in limiting the movement of some of the international technical advisors that provide support to the program in the field. There's been some impacts on research that we're engaged in to better understand the ecology, the biology of the disease, and look at potential therapeutics. Not that we have a vaccine, which we certainly would like, but it has reduced our ability to do some additional work. But we're very blessed and fortunate that the National Ministries of Health saw guinea worm and the surveillance for guinea worm as a key priority. And because we do not do what a lot of other neglected tropical disease programs do based on mass drug administrations, since we don't have a vaccine to provide to people, that has allowed us to continue to operate. And so we're about 95% operational throughout the duration of the pandemic. And we look forward to the fruits of that come next year, as we expect continued reductions in the incidence of guinea worm. But again, I would also note that COVID-19 has other impacts psychologically for staff, their families, how it's interpreted in communities across West and Central Africa and East Africa, where they may not see the same 24 news hour media cycle that we see every day, but it still takes a toll. And so we've been very sensitive and supportive of our local staff and the volunteers, and continue to prescribe all of the normal expectations that we hold to minimize and mitigate potential risk of COVID. And so we take all of that very serious. So despite there being a pandemic, we continue to be very safe and secure in how the program operates in each of the countries.
Thank you, Adam. I must say, a lot of the questions coming in are wanting to relate the experiences you guys have to COVID-19. So let me give you this one, and maybe Bill, you can take this one on. For the panel, the questioner says, it seems like you guys are talking about a marathon in terms of any idea of eradicating COVID-19. Are people unrealistically expecting a sprint? And I think you've sort of already said that that is the case. There's no way that we should be talking eradication right now. But then Bill, just talk me through from your experience with smallpox. What can we expect in terms of the timeframes for truly being able to talk about control of COVID-19, and then maybe in certain parts of the world, talk about elimination, because as I understand it, elimination is about getting rid of it from certain regions and areas, even if it still exists, beyond those spaces. And then the time frame where we might, talk about eradication, is that going to be decades away or centuries away? What is your feeling of where we're at with COVID-19?
I think we're really looking at both a sprint and a marathon. If you can think of a long distance course, but we are sprinting. I mean, you see how fast the vaccine development has been. And I think one of the things that COVID-19 has brought to the fore is the separation between public health and politics is not that great. We don't make any public health decisions that are not somehow based on a political decision. And we're learning that now. It used to be that I would get upset about a political decision that did not help public health. And then my deputy said, well, it's all your fault. You should have anticipated what they needed to know before they made a decision. So we have tried to provide more information to politicians, but it's a very timely type of thing. And I think now I try to tell public health people, go into politics. And this is much more efficient. Okay, how long will it take? I think with good vaccines, we're going to see a fair amount of control within the next year or two, because people will see that the vaccines actually work. And with smallpox, it was a mystery to many people until they saw that the vaccine worked. And I think the same thing is going to happen with COVID-19. I think it'll be very difficult at first to think about eradication, because with respiratory diseases, you look at how difficult it has been to control measles because it spreads through the respiratory tract so easily, so that it's difficult. On this, and at the same time, though, the fact that it spreads so quickly allows you to do surveillance and know where it is at all times. So we're learning about COVID-19. As we learn in the next year or two and watch the case rates go down, we may learn enough to say, yes, we could eradicate this disease. We just don't know that much right now.
Right. Thank you very much for that, Bill. That was fascinating. Here's another really interesting question. I think a lot of people around the world watching this will really appreciate having you, Don, and you, Bill, on this panel, because you bring such a weight of experience and field work and everything else to our discussion of what eradication really means of a disease. So here's one, Don, that I'd like you to take on. The question is, knowing what you know now, would you treat the eradication of smallpox differently compared to the way you treated it and the decisions you took in, say, 1980? Well, that's commenting on the 40-year anniversary. Let's take it back beyond that. Let's say 1960. You know, if you could sort of, what do they call it, Monday morning quarterback, what you were doing in, say, 1960 or the late 60s, would you do it differently? Could you have actually run the smallpox eradication program better, do you think?
Well, I think one of the most important things we learned during the smallpox eradication program, in fact, was learned by Bill Fagey in Southeast Nigeria, whereas in the beginning of the smallpox eradication program, we felt that the most effective way to attack smallpox was to mass vaccinate the population. And if you could get up over 80%, 85% of the population immunized against smallpox, that would allow you to stop transmission of smallpox. Bill and his colleagues in Southeast Nigeria discovered that, in fact, even much more efficiently, if one concentrated vaccinating those communities, those families that had smallpox, and the families, the neighborhoods immediately around them, that allowed you to focus on vaccinating less than 5% of a country's population, compared to trying to get up to 85%. The challenge was, however, that you needed to then find out where all the current cases of smallpox were. That was a challenge, but it was a doable challenge. And so the big difference in the smallpox eradication program at the end, that compared to the beginning, was that change in the strategy that we learned during the eradication program itself.
Right. Thank you for that, Don. We're almost out of time. I'm just going to put in one last point, and I don't know if somebody could just give me a brief comment on this. Somebody's just put in this comment. Thanks for an excellent session. May I just comment on the possibility that the big pharma companies are seeking to add to their incomes because they know that mutant strains of COVID will emerge and that the vaccines will be ineffective. I guess that's perhaps a cynical take on what's going on, but is there some truth in that we have to expect that you know, these vaccines, however excited we are today, may not be that much use because there will be mutation and they may not be that effective?
I think there are three
Bill?
major things that have happened in global health in the last few years. Number one is President Carter showed what would happen if you got a politician involved, meeting heads of state. Number two, the Gates family showed what happened if you put money behind global health. And number three, Merck Drug Company showed what could happen if pharmaceutical companies got involved in global health. And we tend to think that they're always looking at the bottom line, and that's very important to them. But what Merck showed and Roy Vago showed is that these companies can, in fact, improve what happens in global health. And what they're doing right now, they don't know what's going to pay off. And I think it's been quite a remarkable coalition between government and the corporations to get us where we're going right now. So I wouldn't be that cynical about the only reason they're doing this is for profit.
All right. Well, I like to end on positive notes on these discussions, so I'm gonna take that as a positive. I have to tell you that all three of you have been such brilliant panelists. You've given us real insights from your work in the field. You've given us the voice of experience, and you've also given us a sense of real positivity, given that, you know, what we must remember 40 years on is that the battle against smallpox was a wonderful success story, and it is worth remembering that today as people go through the stress and strain of dealing with COVID-19. So at this point, all three of you, I'm going to give you a very big thank you from me and the whole WISH team. Thanks for participating in this particular session. It's been a pleasure talking to you. I'm going to thank everybody else for listening and watching to this session. I always like to end with a thought, and I just think my thought to end this one is that we talked a lot here about this battle against disease and the effort to eradicate disease being all about not just top-down, not just brilliant science, but also engaging with people, the people who are suffering from these diseases at their community level, winning trust, acting in good faith. If everybody in this process, from the politicians to the public health officials to the brilliant scientists, to the people on the ground who have to take the behavioral actions to make eradication real in their communities, if all act in a way that encourages trust and good faith, that surely is one of the absolute keys to making eradication real. So with that thought from me, and with thanks to the panel, I'm going to end this session and wish all of you a very productive WISH Conference 2020. Thank you.